So many faces in our virtual room. First, I'd like to start off by thanking Dr. Stephen Hoffman for taking the time to join us tonight. But before we let him speak, I would just like to give the brief introduction of such amazing things that he's accomplished. Dr. Hoffman is the Dadalay Distinguished Chair in Global Governance and Legal Epidemiology and a professor of global health, law, and political science at York University, the director of the Global Strategy Lab, the director of the WHO Collaborating Center on Global Governance of Antimicrobial Resistance, and the scientific director of the CIHR Institute of Population and Public Health at the Canadian Institute of Health Research. His research leverages various methodological approaches to craft global strategies that better address transnational health threats and social inequalities. Past studies have focused on access to medicines, antimicrobial resistance, health misinformation, pandemics, and tobacco control. Stephen recently advised the World Health Organization on the development of a global strategy for health systems research and was lead author on the background paper that provided the strategy's conceptual underpinnings. Tonight, he joins us from his home to yours for this interactive webinar where we will discuss how Canada has responded to this pandemic, followed by answering all of your questions. Please feel free to type in any questions you may have for Dr. Hoffman in the chat, and our moderator, Phil, will be asking them on your behalf. Once again, thank you all for coming tonight and for your support. And the room is all yours, Dr. Hoffman.
Great. So a big thank you to JNF for the invitation to give this webinar. I think these are really extraordinary times that we all find ourselves in. So it's really important that we find other ways of connecting with each other. So I just think it's great that JNF is bringing together this series, and very happy, very honored to be part of it. So my goal for today is to convey a little bit about Canada's response to COVID-19. My goal is really to impart sort of what's happening right now, how what we've been doing in Canada compares to other countries, as well as what might come next. And there will be time at the end to answer questions, which I'd be happy to do. And so the first thing though, before starting, let me just convey that from my vantage point, so I'm a researcher who studies pandemics for a living. And so my own research, I focus very much about how can countries work together to address different kinds of infectious disease threats, like a pandemic, antimicrobial resistance, and others that defy national borders. Certainly though, it's a totally different experience studying pandemics and living through it or responding to it, as I'm now doing. Much more exciting actually studying it and researching it. I find it's a great area of work. Far less exciting, all of us staying in our homes and then being part of the Canadian government's response. So it's really with that latter part that I'm going to be speaking today as someone who works at the Canadian Institutes of Health Research, someone who's been part of mobilizing and co-leading the Government of Canada's research response to this outbreak. And I'll jump to my conclusion at the beginning, which is that I think when one looks at the way Canada has responded to this outbreak, I think we've actually done a very good job. And to the point that I would say that if I got to choose which country in the world I could be in during this outbreak, I would choose Canada. And so let me though convey why I think that through the course of the next few minutes, or more than a few minutes that we have together. So let me start, and I hope you can see my slides changing. So COVID-19 in Canada. So as of today, or as of yesterday, so we have 37.6 million people living in our country. Our first case of COVID-19 was detected January 25th, 2020. And since then, of course, the outbreak has spread. The good news is that some of the early cases were very quickly identified in Canada and contained. But eventually there were enough cases that arrived in Canada that we early on started to see some community transmission. And once that happens, you then see cases increase on an exponential basis because it's really all about the amount of opportunity that the virus has to transmit from one person to another, whether directly or by contacting various things. And so as of yesterday, there's 40,824 cases of COVID-19 in Canada. and unfortunately just over 2,000 deaths. So quite an outbreak in the Canadian context, but also quite a bit less than we see in many other countries. So in terms of when we look at the Canadian map, what's important here is that there has not been an equal distribution of cases across the country, as we would expect, because our population is not equally distributed across the country's vast geography. But what you will see is that there is more or less a proportional distribution of cases according to population in our country, with the one exception being Quebec, where Quebec has faced a greater outbreak than other provinces in the country. And then BC, as a proportion of its population, has fared a little bit better. Now, I could walk you through a detailed sort of step-by-step approach of living through COVID-19 in Canada, but this is a Canadian audience and I don't want to put anyone through post-traumatic stress about living through this, but I will just wanted to highlight that COVID-19 in Canada is both a virus and a disease that is caused by that virus, but it's also the reaction and the response to that virus that we have to think of when we think of this outbreak. And of course, all of us are affected by this. So we're affected by the virus, but we're also affected by the outbreak of fear, misinformation, of stigma, of racism that we see simultaneously that's come with this virus, as well as we're all, of course, affected by the very measures that are being implemented to protect all of us. And of course, those measures are important. And so it's great that everyone is at home and staying at home and limiting their contacts with other people as much as possible. We need that, and we need to continue doing that for quite some time. But we also need to be thinking about that we're living through not just a virus outbreak, but also an outbreak of other things, as well as all the measures that we're all daily living through. So with that, let me just walk through or highlight a few and thinking of them as sort of layers of this reality in which we're currently all finding ourselves living in. And so the first date I'll just point to is January 7th. This was the day that China confirmed COVID-19 as a unique virus. We knew as of December 31st, 2019, that there was a cluster of viral pneumonias for which we didn't know what caused them. And it was 8 days later on January 7th, we knew it was indeed a novel virus, and specifically a coronavirus. Now, at the time, there was just a few cases. We actually didn't have the full information. But 8 days later, the Public Health Agency of Canada had already activated its Emergency Operations Center. 7 days after that, we saw the first screening. And this is probably around the time when you might have first heard about this outbreak over there in China happening that hadn't yet reached Canada, hadn't yet reached any other country, but we probably might have started hearing about it at that point. And it was only 3 days later that Canada had its first confirmed case. Shortly thereafter, the World Health Organization, at the end of January, declaring this a public health emergency of international concern. Going into February, the very first part of the response in Canada to COVID-19 was actually a research response. So I won't talk about this in too much detail because I'll talk about it later, but I'm very proud to have been part of this. And it was on February 5th when there were only a few cases in Canada. And you can see on the slide the number of cases that were in Canada along the bottom. So at this point, there were less than 7 cases in Canada, and the government had already mobilized a rapid research response in preparation for what might have come and what in fact did end up coming. A few days later, there were more screening requirements. There was the first case unrelated to travel from China later in the month, and then an announcement of rapid research funds that were out the door. Moving into March, I won't go through this all, but this was when sort of everything happened. And I still remember that week of March 10th, when it seemed like every day there was a new announcement about no gatherings more than 200 people, and then it was no gatherings larger than 100 people, then 50, and then 10. I think by Friday, March 13th, the guidance was don't have gatherings of more than 5 people moving, because it was so fast the way that information was coming out. And that was also the time we were seeing what was happening in Italy, specifically the overwhelming numbers, which were overwhelming the health system and having some severe consequences in that country. And so as a result, I specifically remember March 13th as a day when Torontonians, of which I am one, Torontonians were all asked to self-quarantine for 14 days if they had returned from travel from abroad. And so I had just returned a few days earlier from the United Kingdom. So as a result, actually on March 13th, I remember that day very clearly because that's the day I found myself in a quarantine period for the remaining of the 14 days from when I returned to Canada. That's also when Ontario announced schools were closing and other provinces followed suit. Various things happened, border control measures. And in the middle of March, that's when we started to have this massive government response in terms of the financial levers that were being used. So $82 billion as part of an economic response plan. And later in the month of March, we had new announcements, whether it was the border closure with the United States to all but essential travelers, whether it was the Ontario listing of essential businesses, the same in Quebec. Later, there was the mandatory implementation of a 14-day quarantine period for anyone coming into the country, essentially expanding what Toronto had requested to be done, now forced through the enforcement of law and some very potentially strict penalties and jail time for people who break that as of March 25th, and then some additional supports throughout. And then just moving into April quickly, this was, I think, a period where it was clear that this was a pandemic that was going to have significant consequences across all sectors of society. And so government has attempted to step in and try to do its best in trying to address the various downstream consequences of these robust public health measures that were implemented in March, whether that's a wage subsidy, whether that's bringing support for particular kinds of businesses, improving access to food, support for Indigenous populations. And the one I'll add, which is at the very end of this slide, today, a big announcement from the Prime Minister announcing an additional $1.1 billion for research and development, which I think is an extraordinary, it's extraordinary commitments for which it's an important part of the response. So that was sort of Canada's response to COVID-19 in a snapshot, but let me convey sort of some comparisons between Canada's response and a basket of other countries, and then I'll dive back into the Canadian response in a bit of a different way. So in terms of comparing, I could choose from 100 different interesting countries. What I did is I ended up choosing to compare Canada's response to the US and the United Kingdom, just because that's what we always do. And then I additionally am comparing it in these next slides to Italy, given Italians were the first people outside of China who really bared an enormous burden of this outbreak. So in a sense, by looking at Italy, we get a glimpse into a potential future unless we do things that they didn't do in the timeline. And then the other country I've looked to for this is South Korea, because there's a lot of talk about what South Korea has been doing, particularly when it comes to testing. And the sixth country I'll compare to is Israel, because I thought that would be of interest here. So in terms of comparing responses, let's first look to school closures. This is just one easy way to compare when did countries start to act in a certain way. And so if we look on a chronological basis, so these six countries have all implemented, at least one jurisdiction in each of these countries has implemented school closures in the course of the month of March. Now, South Korea was first because they had cases earlier. 2 days later, Italy, Canada, and Israel, coincidentally, both announced school closures on March 13th. US later, UK much later. They initially had a different strategy, and they started following a more containment strategy a bit later. So that's why that's a bit delayed. But this is chronological. And so instead, now let me, in this next figure you're going to see, I'm going to compare not on the basis of days of the month, but when did different countries implement school closures as per the number of cases they had on a per capita basis. And what you see there is actually Canada was then the earliest country to implement school closures. we in Canada implemented, it was Ontario that implemented school closures when there were only 3.6 cases per million of our population. Other countries implementing it quite a bit later in the course of their epidemic curve. And that's quite an important thing. The second is when we can start to look at border closures of some kind. Now this is in the case of, there's many different kinds of border closures, but if you look at just any kind, so like travel restrictions from one country to another, again, we'll see that 5 of the 6 countries have implemented at least one kind of border closure during the month of March. Italy earliest, Canada, other countries after. But then when we look not on a chronological basis, but on the basis of where each of these countries were in their epidemic curve, we'll see again that Canada was actually the earliest to implement some kind of border controls with respect to, on the basis of the number of cases that we had. So it was when we had 8 confirmed cases per million people in our country that we did it, as opposed to others that did it quite a bit later. And then just to note that South Korea, which we're probably hearing about a lot in the newspaper, putting it forward as a model country, it's important to flag that they actually haven't initiated any kind of border measures, even up until now. So you or I could actually fly to South Korea if we wanted to, although we might not be able to get a flight because well, Air Canada is not flying there at the moment. And I don't know if there's another airline, but that's another story. Looking then at another way of comparing would be, what was the early research response, right? So we know that in any case of a novel pandemic, one of the important things is how are countries going to mobilize science in order to respond. And so in this case, the real standout is the United States. I mean, the United States' investments in health research is extraordinary and uncomparable to any country in the world. And indeed, on February 6th, they released almost $1.8 billion for COVID-19 research. So a lot of that money was repurposed money from other things, but in any event, it's an extraordinary amount of funding. But then if we then think of on a per capita basis, again, the Canadian response was pretty good. And I'm a bit biased here because I was involved in this, but on February 10th, that's when Canada formally launched almost $55 million Canadian worth of research funding. And again, if you think of where we were in our outbreak, that was when there were only something like 10 cases in our country. We mobilized $55 million. Other countries were smaller responses, also later responses. So again, I think we did pretty well on that front. Here's the curve. So we talk about flattening the curve. This is the curve that everybody is talking about. The goal is to get as flat as possible. And indeed, if it's perfectly flat, so just horizontal, that means that there's no new cases on this figure that you're looking at right now. And so again, these are our 6 countries. The fact that the United States has the most cases is not surprising because of course the United States is the country with the most people. So it would be higher up on this list. The other important thing to note is that this figure is highlighting, it's using a logarithmic scale. So on the left-hand side, you'll see that it's not actually, it's not going like 10, 20, 30. Instead, it's going 10, 100, 1,000. And so what that means is essentially it's helping us look for how long does it take for an outbreak to double. And what you're trying to identify is like what's the trend line, because that's what's important on these kind of curves. Because a trend that's, as I mentioned earlier, that's totally flat, that means that we don't have any spread. There's no doubling. Alternatively, the more it looks like a vertical line, that's when it starts to get very scary. And so here what you're seeing is that in most cases, these curves sort of look similar. I think the 2 real standouts are South Korea and Italy. So if you look at the South Korean response, it was really a hammer, right? So it's at one point on March 1st, we see that there was a very fast rise of cases in South Korea, but then very quickly they imposed a lot of measures and it flattened right out. The other standout being in Italy, when you can see just that very fast amount at the beginning, right? And so unfortunately, a spread of cases early in an outbreak causes higher cases later just because of the way that infectious diseases spread exponentially. And a lot of that is explained though also by testing. And so here, this figure is showing it's the same 6 countries, and this is showing the number of COVID-19 diagnostic tests that have been performed per capita within these different countries. And what you'll see here is that Israel is the standout. Israel has performed, of all the countries in the world, it's one of the highest countries in terms of the total tests per capita that it's performed. But what actually matters even more than total cases today is how fast testing was ramped up earlier in the outbreak. And so that was the secret sauce that South Korea had that made its response very effective. And so you'll see that red line from South Korea. They were very impressively able to scale up testing early in the outbreak, which then meant they were able to contain much more easily the spread of COVID-19. It's as opposed to what you're seeing in the United States is the opposite of that, where the United States, well, now on a per capita basis, they're not so far off from Canada, for example, and they're even doing more testing than South Korea. But the outbreak is so much worse that you actually, for the United States to be as effective in its testing than South Korea, the United States would have to have an exponentially higher amount of testing than what South Korea needs, unfortunately, given when it was able to scale up its testing in its epidemic. So that was I was trying to give you a bit of a snapshot of what Canada's response was, how does it compare to different countries. But let's take now a little bit of closer dive at Canada's response in a more thematic way. And so the first thing I'll say about Canada's response is that it has been a total government response. This isn't a health ministry response. This isn't a social ministry response. What we have seen is an entire government mobilizing to try to address this outbreak. And indeed, I'm going to be the first one to say that no government's response is going to be perfect in a pandemic. Certainly the Canadian government's response hasn't been perfect. No government's response, though, can be perfect. Because indeed, we don't actually know what the perfect response is until after the outbreak, when we get to look in the rearview mirror and say, okay, that was a good move, that was less good. We should have timed it here, timed it there. But what we can say is that at least what we're seeing in Canada is a total response. Government is really doing, I think, all that it perceives that it can do in order to get us onto the right track. $82 billion economic aid, $72 billion of wage subsidy, $1.4 billion for research, development, and manufacturing of countermeasures. And then just to then hone in terms of that total government response, I want to hone in then first on the research response. And so again, this is, I'm biased, I was part of this, but I think that when you look at it, when we first, at the Canadian Institutes of Health Research, we first activated our emergency response on January 20th. That was 2 days before Canada's first case of COVID-19. And it wasn't because we knew that this was going to come out in this way. We didn't. But we did see the risk. And we knew that no matter how this risk goes, or whether it's bad in Canada, or if it was going to stay in China, we knew that the risk there was to Canadians, and that Canadian researchers are going to be an important part of the response. And so we had to figure out, how do we mobilize that? So it was on January 20th. I remember I was boarding a flight in the morning, and I heard a comment from the president of China, and that made this extraordinary statement calling on provincial leaders in China to make sure that they're working with international authorities and releasing all data. I remember thinking, like, that's a weird thing for the Chinese president to say on January 20th, thinking, and I remember at the time when boarding a transatlantic flight that, okay, is this going to be that pandemic? Is this it? And then by the time I landed in Toronto, and then when we got then the provinces in China, specifically it's Hubei province in China, suddenly reported an extraordinary leap in the number of cases, likely in response to the Chinese president's call for that. Suddenly it was like very clear, okay, this might be that inevitable future pandemic that people like me research on a daily basis, and that we all have thought about, planned for, have done research on, but hoped that day would never come. And anyways, I remember when I landed on my way home, calling and a colleague of mine who leads our Institute of Infection and Immunity, and then we activating the research response right away. Anyways, that proceeded, pre-announcement. The other extraordinary thing just to flag is how fast this happened. So between the time when we formally launched, it would on February 10th, after giving a pre-announcement to let people know this was coming, we gave researchers across the country 8 days to apply, an extraordinarily short timeline. But in return, 10 days later, they knew whether they got the funding. And indeed, we were then able to support additional projects thereafter. And that was a $55 million response. Beyond research, though, there's been a series of policy actions that have taken place in our country. And they go in order, right? So first there were border screenings. And then on top of that, there were some border closures. And then on top of that, most recently, there was a mandatory quarantine for anybody entering Canada, except those who travel across for healthcare reasons, the US-Canada border. And then when you look within Canada, that's at the border. So within Canada, we've seen progressively the start of school closures on March 13th, then a recall for remote work and limits on gathering, closure of non-essential businesses, and then closure of parks, recreational centers. So it's these are layers of protection. I think that's the most important way of thinking about it. But then beyond the policy action, there's been huge financial measures. I've talked about them already, so I won't go into detail, but we're talking about there's measures for employees, there's measures for businesses, there's measures for Indigenous communities, there's measures for individuals and families. And the attempt is, it's a recognition that a pandemic does affect every sector of society and every person. And so there's this attempt to try to address some of those downstream consequences to the extent that the government can. And then beyond money, there's also communications. So there's some public-facing tools this government has been using, whether it's the daily press briefings from the Prime Minister and the Chief Public Health Officer, also the press briefings from provincial and municipal authorities. There's the Government of Canada's website, so www.canada.ca/coronavirus. It's sort of meant to be a one-stop shop of information. But there's also been, when you look from a more, I guess from a research perspective, if you're kind of taking a broader view of what this messaging is, I'll just flag that I think that there has been actually a surprising amount of consistency in messaging that's based on evidence across Canada. And you wouldn't necessarily expect that. So in a sense, because every province is going to be different, every person is going to take a slightly different look at things based on their individual context, as well as based on the data emerging from their jurisdiction. But it has been interesting how consistent the response is and how the provinces have been mirroring the federal government in taking a whole of government response. The other is that, which I'm pleased to see, is that we also keep on hearing reminders that the situation is changing daily, because it is, and we indeed don't know everything, and we're only going to be learning over time. With great responsibility comes great power. This is the opposite of the famous Spider-Man quote, right? So many of you might remember that quote, with great power comes great responsibility. I think what we're seeing here is that because governments feel an enormous sense of responsibility, they are making use of their powers. And this isn't just a Canadian context, this is globally. We're seeing governments acting in a big way, in all sorts of ways, which I think reflects the burden that they feel of that responsibility to deliver for their citizens. But they're certainly using powers that, well, someone like me has never seen a government use in my lifetime. And so that's quite a thing. Moving beyond Canada, or at least moving beyond, sorry, not moving beyond Canada, but moving beyond Canadian government's response, I think many of you are probably thinking, how do we return to normal? How do we get back to where we were? And the first thing I'll flag is that there maybe are some aspects of normal that we don't want to get back to. Now, I certainly don't want to be cooped up in my house for any longer than I have to, and I'm sure you all would agree with me for that. But I think what's important is when we should actually take time during a pandemic to also be reflecting on our core values and the kinds of things that we actually do want to be returning to, the kinds of activities we enjoy, the kinds of issues in our society that we care about, but also some things that we don't necessarily want to return to, such as environmental sustainability or inequality and the various things that I think all of us care about. That being said, we want to get back to some semblance of normalcy in terms of being able to carry on with the things that we do value in our lives and the social connection, travel, and everything that comes with it. And so what's the good news is that we are actually seeing some very good data in Canada. I mean, the measures that people like yourselves and anyone else have been taking to encourage, to be physically distant and ensure that we're not further spreading this virus has been starting to bear fruit, in that we are seeing a flattening of the curve, like I showed you in the earlier slides. The downside, though, is that we're not through it yet. And so we're hopefully at the peak in some provinces, but we're not, that just means we're at the height of the number of cases per day. That doesn't mean that we're through it. So we are looking at these measures in place for quite some time. Although hopefully, if good news continues to emerge, maybe in a few weeks, we'll be able to start gradually lifting some of these measures that have been put into place and gradually return to some sense of normalcy. The key being there, it's the gradual. And the reason I flagged earlier that we can think of these measures as sort of layers of protection is because we're now coming to a place where governments are starting to think through that, okay, we still need lots of protection for this public health threat, but maybe as the data gets better and as things are working and as cases go down, maybe we don't need all of the protection. Maybe we can strategically place which layers of protection we peel off. And of course, governments are going to make those decisions, and they're going to make them ideally informed by both how important that layer of protection is for the risk that we face. So how much protection does it give us? But also, what are the downstream consequences that we face from keeping it in there? So for example, one approach could be that government might slowly increase the size of gatherings that are allowed, maybe going to 5 and then to 10 and then to 20 people for gatherings. Or maybe it'll be about allowing certain businesses to open, maybe those that are able to implement public health protocols to make sure that there can be safer environments, or businesses that are entirely run outdoors where there's less opportunities for transmission. Alternatively, maybe it would be schools where we say, okay, maybe we prioritize grade 12 students who are at the very end of their high school education before going off to either university, college, or before going into apprenticeships, wherever they're going. Maybe we say, okay, this is the last time they're in that kind of school. Let's prioritize them. And maybe teachers who are usually teaching grade 9, 10, and 11 step in to help and then have more classes of grade 12 students. So we basically could maybe reduce the class size to a quarter of its usual size by making strategic decisions and separating people in different classrooms. There's lots of different options that governments face, and those will be, of course, informed by the data, but also based on citizen values and what people would like to see and what kind of risk is important to still mitigate, but what sort of protections can be slowly relieved. And so that then leads us to sort of the end game. And this is where I'm gonna conclude, because when we think of it, a gradual return still creates the situation where we have a risk, because indeed we are as susceptible to this virus now as we were a month ago when it was spreading exponentially, because we don't yet have a vaccine and we don't yet have immunity. So what is the end game? And I'll just emphasize that there are 4 possible scenarios, other than the very bad one that we all get it. And the 4 scenarios that I think could happen all depend on science, which is why I feel very lucky to be working in a scientific enterprise and being part of the Canadian Rapid Research Response. Because those 4 scenarios, which you'll see on the slide, are really about, there's only 4 ways out of this other than too many of us getting this virus. The first is we need either boosting immunity. So for example, we could do that through a vaccine. That's I think what everyone's really hoping, and certainly what we've been hearing a lot from governments around the world. The other, though, exit scenario, the other end game is if we can figure out a way to reduce the severity of this virus and the disease it causes. So if we were able to identify an effective treatment that cut the case fatality rate to 10% of what we're seeing right now, suddenly this would start to look like the seasonal flu in terms of its deadliness, which would totally change our response to it. So that could be another game changer. The third is about scaling containment. if we had a mechanism in the technology where every day we could get tested for whether we all had the virus that causes COVID-19, that would be a game changer, again, because we would know right away and we could implement containment measures on a scale that we otherwise couldn't do. And the fourth option would be about more targeting our public health measures to apply to those who don't have immunity. And so this could be enabled by serological immunity testing, which actually the government of Canada just announced funding for that today. But what that's really about is trying to identify, are there people who, because they've had COVID-19 or naturally, that they have some kind of immunity to this virus such that they could be going out and about and doing their business. So let me just end by flagging, as I said earlier, I think emergencies are opportunities for all of us to reflect on our core values. And I think what outbreaks like this highlight is that we not only have to be proud of ourselves during the outbreak, we have to be able to look in the rear view mirror when we get through this on the other side and be proud of our response. And so I think often we hear in the media this sort of balance between, do we safeguard public health or do we respect human rights? Or do we do what's good for certain people, or do we value diversity? I think in the Canadian context, I think that these trade-offs are actually not really there. The best public health response is one that upholds human rights. The best for people are one that reflects the diversity and multiculturalism of our society. And so I think this is our opportunity to hone in on what do we value, what do we care about, and to make sure that those values are informing our response. And then the very last thing I'll say is, it's not only then just informing the response that we do today, but also we need to make sure that we learn what our core values are and how to respond to outbreaks in the Canadian way in order to inform how we respond to future outbreaks. Because indeed, in my research and many others, what we're seeing with COVID-19, this actually is not the worst case scenario. And I know that sounds scary. There's actually, I mean, this virus could be one that transmits more than it does. It could be deadlier than it is. The key is then we need to maximize what we learn during this outbreak in order to inform the next inevitable outbreak that we get, so that hopefully we don't go through what we're all going through right now. So with that, I'll end, and I'm very happy to take questions. Thanks again for this opportunity.
Thank you, Stephen. It's actually the second webinar I've watched you on discussing Canada's response, and you're fantastic. Every time you speak, really, you're engaging. The information you give, it's great. It's beats watching the news. I'll tell you that much. So with that being said, a lot of the viewers actually do have a lot of questions. So we're going to try to get to as many as possible. But one commonly asked question has been if you can comment on herd immunity. So.
Great. Sorry, I was muted. So thanks for unmuting me.
No problem.
Yeah. So herd immunity. Well, herd immunity is basically this idea that if enough people in a society or a community have immunity to a virus or bacteria, something else, that what that means is there's less opportunity for that virus to spread, right? Because let's say I have immunity or let's say I have the virus and the people I'm all interacting with have immunity, then I'm not spreading the virus to anybody because I'm only coming into contact with people who have immunity. And so in this case, we actually don't need everybody to have immunity to a particular virus before the virus no longer poses a threat to people. And so the estimate for COVID-19 is that about 50 to 70% of the population would need to have immunity in order for us in Canada to achieve herd immunity that would essentially end the outbreak. So it's only about, it's 50 to 70% of the population. It's for us to go back to business as usual and not have this outbreak be able to spread. Now that immunity can be achieved either through a vaccine. So the good news actually is that when we do hopefully in the future have a vaccine, we actually don't need everybody to get the vaccine before we're all basically safe from this virus.
So what would you say?
50 to 70%.
So what would you say to the professionals who are recommending that we should just deconfine, go back to normal, the old normal, and take our risks, catch the virus? Oh, are you unmuted?
Sorry, it's me. I'm used to muting myself to make sure there's no background noise while I'm in meetings. I'm going to stop doing that because I'm not allowed to unmute myself. You, Phil, are the
You're
one
free to do
power.
whatever you want in this meeting.
No. Yeah. So the challenge with that, so the key is that we want to make sure that we don't have so many cases of COVID-19 at any one time in Canada that it overwhelms our healthcare system. Because that's what we saw in Italy, and that's when we saw some of the most difficult decisions that anyone could possibly make had to be made because they just ran out of healthcare capacity. And that's when we talk about flattening the curve. The reason we want to flatten it is in two respects. One is because we want a totally flat curve like I showed you earlier in the webinar. But what we also want to do is make sure that the total epidemic curve of active cases stays below the number of intensive care, or it stays below our capacity to treat people in hospitals and such. So the key measure would be, it's two key measures. One would be how many beds do we have in intensive care units across the country? And the second key indicator we're using is ventilators. How many ventilators do we have in the country? How many are being used?
So on the topic of hospitals, we actually have a question. Do you think the country, as a country, our clinical/hospital-based response has been appropriate? And what would you have liked to have seen done differently?
Yeah, so it's a great question. I mean, there's 1,000 hospitals, you're gonna get 1,000 different responses. So impossible for me to sort of react in a more granular way. But I think there's a couple of things that I think that have been done well. So early on in the outbreak, so if you remember in early February, when we had just a couple of cases popping up in BC and Ontario and Quebec, we saw actually some very impressive healthcare facilities that were following the kinds of protocols we'd exactly want for a novel pathogen like this was. So what that means is people phoning ahead, letting them know. It was emergency medical services, ambulances taking all the right precautions, making sure people were not exposing others in the hospital triage environment. So it was very impressive. I think one challenge that's been exposed, though, is how much protective equipment was stockpiled. And we've run out, right? And I mean, we haven't run out. There's been extraordinary measures in order to resupply, but we've come very close to running out. And indeed in Ontario, there was one point where there was only a 7-day supply left of masks for healthcare professionals. And frankly, if we can't protect our healthcare professionals from getting this virus, we're done, right? Because that means suddenly we can't activate our response to a virus. So, I mean, they're the top priority. And that's indeed why you're hearing public health authorities ask people not to purchase medical surgical masks or N95 masks because both because most members of the public haven't been trained to use them and then therefore won't actually benefit from them in the same way, but also that healthcare providers need them. So anyways, there's been a mixed response, I'd say, lessons learned, and certainly every place could always do it better, but overall I'd say we've reacted very well across Canada.
So at first we were trying to flatten the curve as to not overwhelm our hospitals and healthcare workers. However, we see now, and especially in Quebec, our long-term healthcare centers have been hit hard. Was this a surprising scenario? Did you see this coming?
Yeah, so this is a great question. And in fact, I'm glad this came next because it gives me an opportunity to clarify that I would say while in hospitals we've seen, I think, a great response, we haven't seen as great of a response in long-term care, but it's also partially because of the way we organize long-term care, right? So, I mean, one of the early issues that came on is that many people who work in long-term care facilities are actually working in multiple facilities, which then means that people who are working can become a vector for transmitting between one long-term care facility and another. But we could blame the workers, but actually, I mean, we could also blame the way we've structured contracts in these facilities, where instead of giving people full-time employee salaried jobs, we haven't investments in long-term care facilities such that through cost-cutting measures and such, we have people who have to bring together a series of precarious contracts in order to find work, and that will be at multiple facilities. We've known that that was going to be a risk, but it's a risk that we took as society in the way that we organized long-term care. Another one is just that there is a known reliance in long-term care on families of people in long-term care facilities to provide some support, such as helping to feed and such for those who need that supportive care, such that the staffing ratios are not designed for environments where you're not allowed visitors to provide further support. So that's been a real challenge in long-term care facilities, such that now in certain provinces, there's actually now a mobilization of additional qualified staff to be supporting at this extraordinary time.
So you mentioned that, no government's perfect, no response is perfect, and we live and we learn, unfortunately. But there's been a lot of talk now about in the fall, this can all come back. Have we learned enough to not let it get to this point come the fall?
Yeah, so just to flag, it could come back before the fall if we're not careful in the way that we gradually lift some of those layers of protection. Yeah, so I think that the key will be what sort of technologies and processes we can put in place to better address this. So, I mean, the big difference between now and January is that in January, we didn't know how big this was going to be. And so we didn't know what kind of protective measures we should put in place. And indeed, if we put in too many protective measures, it actually can cause all the harm without the benefit. And indeed, after in H1N1, that was around 2009, that was the outbreak at the time, there was a robust worldwide response, but it was deemed to be an overreaction because in the end, while many people got H1N1, it wasn't as severe for people who got it. So the point being, we have learned some things. We've learned a lot. We know how much of a risk this does pose. And we have new science and technologies that are coming up that are going to help us respond. I think the game changer is going between now and the fall would be testing. Testing. We need to be scaling up our ability to test whether someone has this virus or not. If we can do mass testing, we'll be able to contain any flare-ups of this outbreak. If we have that means, and if we have then the public health response ready to go. So I think we could be in a much, much better position if this comes back than we were when this first initially came.
And on the testing subject, one of the participants says, cases only represent confirmed serious cases. How will we know the true number of those infected with mild or asymptomatic illnesses?
Yeah, so in some respects it matters a lot about, so we know that the confirmed cases are just a shadow of what the full outbreak is. And so, I mean, one guess would be that maybe there's something like 4 times as many cases in Canada as there are confirmed cases. That's a guess. It's not based on too much because we don't have much to base a guess like that on. But in some respects, it also doesn't matter because what matters most to inform decisions is not the absolute number, it's the trajectory. And so as long as confirmed cases are consistent in the proportion of total cases that they represent, then actually most decisions that governments would take would be informed by the trajectory, not by the total number. So that's actually an important thing. So for example, whether there's 4 times as many cases of COVID-19 in Canada versus confirmed cases, government response would be exactly the same because it's really mostly being formed by how many cases there were yesterday versus today versus what will happen tomorrow. Now that's only most decisions. We still do need this data for other decisions. And so today it was announced there will be an effort to look at Canadian immunity to COVID-19 through random sampling processes. The exact details of that were not announced, but today there was an effort to look into immunity through blood tests and such.
So while we're guessing on certain things, one question that keeps coming up is if you had to take an educated guess, when would you say you think this curve will start to flatten?
I think it started to flatten already. So we got, at the beginning of this week, we got good news in most provinces. The one big exception being Alberta, which is likely fueled by a super spreading event that happened in a long-term care facility. But most parts of our country, and probably in a few days, Alberta, we will start to see the flattening of the curve. So that's what I meant when I said that we've already received some optimistic news, which is what's now, if it continues, it will, in the course of weeks, allow governments to start to lift these layers of protection in a gradual and strategic way, because we've already started to see that. Now, so in that respect, for example, the data looks like in Ontario, for example, that we might actually be at the peak of number of cases. So then basically what that means is that there'd be more people kind of leaving hospital for COVID-19 than coming into hospital for COVID-19. And if that's the case, if that continues, then the risks lessens and lessens over time, and then gets to a good place. So what that means is if we continue to get good news, I wouldn't be surprised if very soon, actually, we start to see the first level of protection or layer of protection be released. And that first layer should definitely be reopening of certain healthcare services that have been suspended in light of COVID-19. Because elective surgeries are only elective at a certain place. Eventually elective surgeries become emergency surgeries if they don't happen at some point. So that will be first. Then I would expect, though, other layers of protection, it'll be at least a few weeks before they start to happen across the country.
So as we gradually start to lift some of these restrictions, social activities like sports, movies, traveling, do you think they'll ever go back to the old normal, or will we just have to learn to navigate with a new normal?
Well, it's interesting. I think this is exactly what I meant by we need to reflect on what kind of things we value and what do we want to change in the post-pandemic world. And the reason I flag that is our business as usual was not sustainable. So when you mentioned traveling as an example, we as a society have emitted so much carbon and so much greenhouse gases that we've been essentially going on an unsustainable course forward. So if back to normal means back to unsustainable practices that are affecting our global environment, then we probably don't want to go back to that, or at least maybe this is our opportunity to not go back to that. The same thing could be said about inequality. So we live in an extremely unequal world where people don't all have the same opportunity. And in fact, over the last few decades in many countries, that those inequalities have deepened, not getting better as overall the world's average prosperity has grown. And so again, it calls us to reflect. I think this pandemic calls upon us to reflect, what kind of world do we want to live in afterwards? So yeah, I mean, there will be a point where we're going to be able to travel again and enjoy experiencing other cultures and sports and concerts and all that. I mean, hopefully that comes rather soon. And as soon as there's a vaccine, for example, that could come quite quickly thereafter. But I think we should actually reflect on what do we want the society to look like, not just what can we technically or physically, or what can we do from a public health perspective, but what do we want to do from a more social perspective?
So you touched on, people being told don't go out and buy masks or certain types of masks because our actual frontline workers do need these. I'm the scapegoat for my family. I'm the one who sends once a week to the grocery store with everybody else. And you see people wearing masks and gloves and they give them this false sense of safety. What do you say to those people who think themselves, I'm wearing a mask, I can walk right up to Joe Schmo down there?
Yeah, so that's actually why masks is so complicated, because it does. So first of all, most people don't use them correctly. So for example, if you are going to use a mask, don't touch it while you're using it. Don't adjust it. Yeah, I see when I'm going to the grocery store, people misusing them. The other is that you're not actually, it's less about protecting yourself. It's more about, if you have it, protecting others. And so I was actually just the last time I went to the grocery store just a few days ago, someone behind me in the line was wearing a mask and came up to me so close that actually she touched me. And I had to sort of look back and say, hey, you're supposed to stay 2 meters away from me. And she sort of said, oh, but it doesn't matter, I'm wearing a mask. So no, that's not the case. And in fact, the 2 meters offers much better protection than the mask would, to the extent that the mask offers protection. So I think that's what's really hard about masks is that they're not used properly. They can actually themselves become a vector for transmitting the virus, if sort of placed in the wrong places or they come into contact with others. And it gives people that false sense of security, which I personally have experienced now once, and I'm sure many of you have experienced as well.
So we're actually coming towards the end. So for anybody who does have questions that we weren't able to get to tonight, Dr. Hoffman's been kind enough to provide his email address and Twitter handle, which we'll be putting up on screen shortly. So you can feel free to contact him with any questions that weren't answered. But we're from JNF Montreal, we being myself and Karen. And a big topic here is Quebec's been hit the hardest. And not just Quebec, but the Montreal-Laval area. Do you have any insight into why Quebec and also why Montreal, why Laval?
Yeah, so I don't fully. I mean, I think whenever one looks in the context of a pandemic, there's always going to be one place that gets hit the worst, and there's always going to be some places that get hit more than others, just simply by random chance. That's part of it. The other is that in the context of a pandemic, when you're looking at secondary sites, the cities that are at greatest risk are those that are the most international. So in fact, some of the very best reasons why many people choose to live in an international city like Montreal, like Toronto, like Vancouver, and for which I think we're all very proud to be Canadian, right? Multicultural, very globalized communities, is also, it's those airports that also contributes to the spread of secondary sites of outbreaks. So actually, I mean, we've known, for example, in Canada, the city at greatest risk of a secondary site of outbreak is Toronto, because it has the most traffic through Pearson Airport. And we saw that risk being realized during SARS, right? So Toronto was the site of a secondary outbreak that any Torontonians on this webinar will remember very clearly. But Montreal is also an extremely international city, and as a result, there is that risk. The good news, though, is as bad as the Quebec numbers might be as compared to other provinces right now, actually Quebec's response and those numbers are actually very good when we compare to other countries. So again, if I got to choose which country I could be in during an outbreak, I would choose Canada, because we do have a fantastic system for public health. And we've been very lucky in our response in Canada that it came to us a bit later, such that we've been able to systematically look out at other countries, see what they do right, what they do wrong, and copy the good stuff, avoid the bad stuff, and have a much more informed response accordingly.
And finally, a little controversial, do as you please with it. A lot of fingers have been pointed at China, that they did not get the word out or all the facts out soon enough, and that the World Health Organization didn't plan or react quick enough. Would you have any comments on that?
Yeah, so again, during an outbreak, no one is going to respond perfectly to it. That's one thing that's important. I would say overall, the World Health Organization's response has been very good. They've been very open about communication, about data. They've brought together a research agenda. They're providing timely guidance. This is the time where we need to support and invest in the World Health Organization more than ever before. We need them now, and we need them more than we ever have. Now, of course, the World Health Organization response hasn't been perfect, but for example, because of the way that WHO is designed, it's a member state organization. It then becomes very difficult for it to start criticizing its own members. And so one challenge I have is actually not so much about WHO holding China accountable for its data, which there's some questions there, but it's also that WHO hasn't been calling on the many countries around the world that have been violating human rights during this outbreak. And so human rights is actually core and built into the constitution of the World Health Organization and into the United Nations, of which WHO is part. And they haven't been talking about the importance of human rights in the same kind of way that someone like me, an international lawyer, focused on public health, would want to see. The other is that when it comes to then more specifically the more controversial part about China, I think that what's clear is that we need countries to report all their data in an outbreak. We need it not just for public health, it's an international legal obligation. China has had challenges in doing so. I think though a lot of the rhetoric has been about whether China wants to do it or not, whether China has specifically been hiding or not. I don't I don't think they have been. And I don't think we have evidence that they have been. I think what we're seeing is that China does not have the same kind of public health system that we have in our country. So it's hard enough for us to report data. And indeed, I've talked to lots of journalists over the last few months. They all complain to me how hard it is to get data on new cases of COVID-19 in Canada. Canada, we're one of the richest countries in the world. So I think what we need to also recognize is that in China, it's extremely challenging context to work and to have data. And even if the Chinese government at a national level wants to release data, that doesn't necessarily mean that all the provinces have an incentive to do the same. And ultimately, we are dealing with a middle-income country, not a high-income country. So in that respect, yes, we need to criticize, we need to call out, we need to hold people accountable. And that's important, and we all need to do that. And there's lots of blame that we can throw around to everyone. But I also feel like what we don't want to do is then come to conclusions that will undermine our ability to respond to this outbreak. So for example, any country that might be thinking about or unfortunately doing a divestment from the World Health Organization, that's the exact opposite response that should be happening. We should see the challenges the WHO is facing, and we should then provide the resources and support so that they can overcome those challenges. So I'll leave, I hope I sort of answered the controversial while maybe-
We haven't gotten any comments, so I think we're okay. You know what, there's actually one last question that came in, and it's a topic that, part of it's a topic that actually comes up here at home with my wife. Everyone's going out for walks right now. Can this virus stay in the air, and should we be wearing masks while out for walks?
Yeah, so basically in an outbreak context, we still need to make sure we get physical activity. So we do need to figure out a way of doing that. A lot of that can happen inside people's homes, but it can also happen in a safe way outside of people's homes. The key is to maintain a 2-meter distance between people. So when I go for a walk or a run, there's some interesting attempts when you walk by someone on a sidewalk, you kind of walk, try to avoid people by 2 meters. And then also if someone is running, maybe try to create more space, because when someone's breathing heavily, if they do have the virus, it might go a bit further than when under normal circumstances. But this is something we actually still don't know. So there's just a study out earlier this week that was re-examining how long the virus could actually stay in the air. We know it's not very long at all, right? It really falls to the ground quite quickly, but we don't know how quickly. Is it a second, or is it 2 seconds, or is it 3 seconds, right? So, and that actually makes a difference. So I'm not the expert when it comes to virology or the way that viruses are transmitted from a biological perspective. But certainly I'm going for walks, but I'm doing it in a safe way and ensuring I'm doing it by myself, and I'm doing it keeping 2 meters away from people.
So I will make sure to listen to my wife when she tells me we're walking down the sidewalk and the biker's coming towards us.
Yeah, it's actually, it's the opposite direction though. It's from behind. You want to, it's because when they expire, they're expiring more, so that when you come behind them, it's less about the direction of travel. It's when you walk in their trail. It's their trail that you have to.
I'll make sure to tell her that you said she was wrong. Karen, just so you know, because I see you laughing, Stephen and my wife work together. They're colleagues. So
I know.
Stephen, Dr. Hoffman, thank you so much for being here tonight with us. Really inspiring, educational, informative. As I mentioned earlier, Dr. Hoffman's being kind enough to share his information with everybody. So you can reach him at stephen.hoffman@globalstrategylab.org. His Twitter handle is @shoffmania. So feel free to send in your questions there. Karen?
S. Hoffman was taken. The Twitter handle S. Hoffman was taken, unfortunately. So my sister helped me be creative.
I just said at home, I love the Hoffmania. That was my favorite thing when I saw it. Karen, any closing words?
I just want to say, wow, so informative. We've been hearing the news every single day, I'm sure, like everyone else on this Zoom call, but this was so informative and so well explained. I'm so happy that we're recording this because I'm going to show it to everyone I know. And you've answered so many good questions that we all have. So thank you so much for all the work that you do. And thank you so much for graciously coming tonight. It really is really appreciated. And from JNF, I say thank you to you. Thank you so much. Really.
Thank you very much, Dr. Hoffman.
Thanks for having me.
Thank you. And
Thank you
again, this recording will be sent out online. So anybody who wants to rewatch it, you'll have a chance to send it to your friends. And again, if you'd like to contact Dr. Hoffman, his email and Twitter handle are on screen right now and will be included in the recording as well. So thanks everyone for joining us. And Dr. Hoffman, thank you.
Thanks.
Thank you.
Take care.
Take care. Stay safe.
Bye.